How does hepatitis C affect your sexual health? Have you ever wondered how hepatitis C might impact your sexual health? Hepatitis C is a viral infection that primarily affects the liver, but it can also have implications for your sexual well-being. Understanding these effects is important for anyone who may be at risk or already living with the virus. First, let's talk about the risk of sexual transmission. Hepatitis C virus is mainly spread through blood-to-blood contact. While sexual transmission is possible, it is considered to be a very low risk, especially among long-term, monogamous heterosexual couples. Research suggests that the risk is approximately 1 infection per 190,000 sexual contacts in such relationships. However, the risk can increase if there is blood present during sexual activities. This can happen due to tiny cuts or tears in the mucous membranes of the genitals, anus, or rectum. Activities that may cause bleeding, such as anal sex or intercourse during menstruation, can elevate this risk. For individuals living with HIV or those who have multiple short-term sexual partners, the risk of transmitting hepatitis C sexually is higher. Among men who have sex with men, especially those who are also HIV positive, there have been documented outbreaks of sexually transmitted hepatitis C in these cases. Using condoms is recommended to reduce the risk of transmission. For monogamous couples where one partner has hepatitis C, health authorities generally do not recommend routine condom use. However, it is wise to avoid sharing personal items like razors or toothbrushes to prevent any blood contact. Now, let's discuss how hepatitis C can affect sexual function. Chronic hepatitis C infection has been linked to sexual dysfunction, particularly in men. Studies show that many men with hepatitis C experience issues like reduced sexual desire and other difficulties even before starting treatment. Interestingly, sexual dysfunction may worsen during antiviral treatment, especially in those with advanced liver fibrosis. This could be due to the effects of the disease itself, psychological factors, or side effects from the treatment. So, what can you do to maintain your sexual health if you have hepatitis C? Open communication with healthcare providers is key. Discussing your sexual health can help you understand your individual risks and the best preventive measures. Practicing safer sex is particularly important for those with multiple partners or co-infections like HIV. Regular testing for hepatitis C is also recommended for partners of infected individuals, especially if they have risk factors like multiple partners or HIV. Additionally, avoid sharing personal grooming items that could be contaminated with blood to further reduce transmission risk. In summary, while hepatitis C is not commonly transmitted through sex in stable, monogamous relationships, certain factors can increase the risk. The infection can also negatively impact sexual function, particularly in men and during treatment. By maintaining open communication with healthcare providers and practicing safer sex, you can manage these risks effectively.